Hello doctors, like I have already covered one two topics in the same series. I will today talk about certain antidotes which are being used in clinical practice in emergencies and which are often asked in NEET PG. So let us start. So first of all, we will take the case of physostigmine. It acts as antidote for four group of medicines which are antihistamines, atropine, belladonna and datura. Physostigmine for antihistaminics, atropine, belladonna and datura. Then for nicotine and organophosphate poisoning, we have antidote as atropine. So nicotine and organophosphate has atropine as antidote. Now, in another example, let us take antipsychotics, tricyclic antidepressants, and salicylates. These all require bicarbonates as antidote. I will repeat it again. Antipsychotics, tricyclic antidepressants, and salicylates have antidote as bicarbonate. Now, what about opioids? You must be knowing it. It is naloxone. And what is the antidote for ethylene glycol and methanol? Sorry. What is the antidote for ethylene glycol and methanol? It is fomepizole. Fomepizole. And what is the antidote for benzodiazepine? It is flumazenil. The fomepizole and flumazenil में confuse नहीं होना है. Ethylene glycol and methanol has fomepizole and benzodiazepines have flumazenil. Now, what is the antidote for amphetamine? It is ammonium chloride. Amphetamine, ammonium chloride. What is the antidote of acetaminophen? I think everybody must be knowing it. It is N-acetylcysteine. Acetaminophen or paracetamol has antidote as N-acetylcysteine. Now, beta blockers. In case of beta blockers, we have glucagon as an antidote, and for calcium channel blockers, we have calcium gluconate. Beta blockers, glucagon, calcium channel blockers, calcium gluconate. And what about digoxin? It has diziband as antidote. Digoxin, diziband. Now, what we use for cyanide for antidote? It is called Lily kit, which use IV amyl nitrite plus IV sodium thiosulfate. Lily kit for cyanide, which has IV amyl nitrite plus IV sodium thiosulfate. And for ergot alkaloids, we have sodium nitroprusside or nitroglycerin. And for MAO inhibitors, we again have nitroprusside or isamolol. Now again, very simple, you must be knowing it. Antidote for iron, deferoxamine. Antidote for iron, deferoxamine. And what is the antidote for heparin? It is protamine sulfate. For heparin, protamine sulfate. And for warfarin, vitamin K and prothrombin complex. For warfarin, vitamin K and prothrombin complex. Now, what are the drugs where in poisoning we don't use dialysis? For benzodiazepines, beta blockers, amphetamines, digoxin, and organophosphate poisoning, opioids, and calcium channel blockers, we don't use dialysis. I am again repeating it. Benzodiazepine, beta blockers, calcium channel blockers, amphetamines, digoxin, organophosphate, and opioids. And what are the overdoses for which or poisoning for which we use dialysis? It is for salicylates, lithium, alcohol, theophylline, and ethylene glycol, salicylates, lithium, alcohol, theophylline, and ethylene glycol. Hope you must be benefited by this small video. I will keep posting all such kind of small information which you will find very useful, and only sparing your valuable 5 to 6 minutes will give you confidence. So let us qualify for the NEET PG and get good marks. Thank you very much.